welcome to the three of you. Today we're going to be talking a bit about this idea of single session therapy. And we were just talking about this kind of merging of ideas that have come together, at least for me, through ART and my exposure to ART. And that's this idea of doing really interesting work within a single session. And I'm sure all of us that have done ART have experienced that. And so I was wanting to take some of those ideas of ART, see how they could be incorporated as part of a single session model. So what I'm going to be sharing with you today is primarily just about the single session model. And there's a lot of good news in this. It's the biggest thing that I see most therapists struggle with in this is taking the leap to believe that something really amazing could happen within the span of a single session with a client. Many of us are, perhaps being trained in whatever various therapies over with thinking the thought that it would take just a significant amount of time, particularly with people with trauma or significant depression and all that kind of stuff. And single session therapy has been used in all those populations and has actually shown some really nice results. I'll share a little of that in the slides I'll show you, but it can be used in a lot of different circumstances. And so I just wanted to bring this forward to therapists. All of you are likely therapists, some in private practice, some may be in some sort of group practice. But to share this and then just beginning to explore these ideas together. That's my hope of this, is that there's things about this that people latch onto, use either some of the concepts or actually try to incorporate single session work as part of their regular maybe menu of services that they're offering clients, and just see what happens with that, particularly as ART gets layered into that. So again, appreciate the three of you being part of this, and those that will listen to this post training and get some of the share some of the ideas that you guys will bring forward as in this discussion as well. So I'll just talk a little bit about single session therapy. I did do some talking about this when I made the pitch to do more training around this, so I'm not going to do a lot. But I'm going to focus a bit, though, on the mindset, because I think, again, I mentioned that was one of the biggest issues that I see folks wrestle with, meaning just trying to wrap their heads around it. So I'll go through some of the common issues, call it mindset, that therapists have to go through in order to kind of incorporate single session therapy into their therapeutic world. And then I'll go through the single session model. There are lots of different, but there's a number of different single session therapy models. There's one that's cognitive behavioral, there's one narrative. This particular one is solution focused. And you're not limited to just doing solution focused, but what I really liked about this when I stumbled upon this, I was sharing this with Sky, that it was a group out of Canada, and they were kind of open sourcing some of this information on single session therapy, and they kind of said, use it. And so I'm using it. I took it, and I'll be sharing it as part of this. But the thing I really like about this solution-focused brief therapy model within a single session, it's very prescriptive. So it's I don't want to say it's idiot-proof, but it's really prescriptive, and it just walks you through it. It gives you a very tangible way to walk through it with your client. And at the end, the client gets a sheet that has everything that you've covered and the plan, what are they going to do when barriers occur in this? How are they going to overcome those? Da, da, da. So it's a really, I think it really is a bit of a plug and play model, if you will. And so I think this will be really very useful for us, particularly if you maybe haven't done single session stuff before. I think it really help you get comfortable with doing that type of work. And then I think as you get more experience doing it, you will likely improvise more. I think if you've done ART for a while, you've likely have done the same, that you've kind of, there's a certain improvisational piece to even ART. Now, okay, official disclaimer, This is not endorsed by ART. This is not, you know, something they're promoting or anything like that. This is just me as a, you know, individual therapist bringing these ideas together. But again, I think they do have some merit and some traction that hopefully you'll find useful. Okay. I was sharing just before, and Liz, you may have missed this, but I was just sharing before we got on the training here that it's been around a long time. And in fact, it's supposedly started at the walk-in counseling clinic in Minneapolis. And so there's strong Minnesota ties to this work. And I think that's pretty cool. And so we want to honor that obviously by bringing some of these things forward here in the state of Minnesota. But and of course, walk-in services, right? This is tailor-made for walk-in services. So if you ever do any of that type of work in your current setting, this will segue nicely into those types of services. But what is true that one is the modal number of therapy sessions attended by most clients, and one means the most. So after one session, people start to drop off, right? But most people, if they're going to come to do therapy, they're going to come for a session, at least one session. And then whether they drop off or not is dependent on a number of factors. But oftentimes we only have one shot, even if we don't know we have one shot with a client. And so it's just a different way of thinking about things when you're looking at a single session making a difference in the life of a client that you're serving. And then obviously with all the changes, particularly COVID's brought about here, you know, we're training online. You know, before COVID, it would always be in person, you know, and same thing with therapy, right? Much more flexibility around that. But I could go off on a whole tangent here, I'll just slightly, you know, but just with so much change in the mental health field, particularly COVID and post-COVID, we have far fewer graduates going through graduate school in any of the, you know, counseling fields for social work or, you know, licensed marriage and family therapists and all this kind of stuff. You have therapists who left the field. I mean, if you remember back when COVID hit, all of a sudden families you know, we were all had to be at home, minimizing contact with others. And of course, a lot of that landed on the mothers in these families, particularly to help with the education of their children. And this field is, I don't know what percent women, but it's probably 80%-ish female. So no surprise that, you know, number of mothers stepped up in that role and left the profession, at least temporarily, and some have left permanently as a result of that. And so just fewer therapists running around, and of course all the demands of you know, just population. We have the aging of therapists, so you know, more therapists are retiring than they are entering the field, and so it's just a challenging time, especially finding folks to do good work with the clients we serve. So the good news is that there's a lot of advantage to single session therapy if you're willing to step into that world. And one of them is that it's fairly well tolerated. And that pretty high levels, and you'll see when we start going through the materials, I think you'll be able to kind of start to understand why this is something that people feel positive about when they step out of the session, because they have a very tangible plan that they can utilize then to move forward. And it's good for, you know, actually both youth and adults. There's a kind of a trend that it tends to be older youth than younger youth, but that's something to keep in mind a bit in this. And that really, because you only have a single session, you don't necessarily have the luxury of doing a, you know, diagnostic assessment and do, you know, all the information gathering. You're kind of hitting the gate from the start about really trying to address whatever it is the client is bringing forward as the issue that day with you. And so it's very in the moment. I like to think of it a bit as you're kind of walking a tightrope. I mean, a tightrope isn't very high off the ground, but you're walking on a tightrope, right? Because it's just you're having to really engage and move and groove with the client and really help come up with something useful by the end of a session, which, for most therapists is an hour or 50 minutes or whatever time frame where that would happen. So, but it's very focused in its orientation too, and you will see that too in these materials. And talking about the materials, you will get everything that I have that comes from that Canada site. I will send to you guys, so you'll have the clinician form that gets filled out in session. You'll have the client form that they take home with them, and even just a very brief a satisfaction survey that you can give clients after this too, if you decide that would be helpful and useful. So yeah, no worries about having to take copious notes about what's on these forms. So and again, I talked about ART already. I just think, again, it's interesting bringing these these models that have fairly rapid change can occur within these. And again, a lot of the change, particularly in single session models, are happening outside the session. Really, in single session, you're creating the plan with the client, but they have to kind of carry it forward. But that's probably true in most therapies that we are doing as well. It's a lot about strengths. You'll see in some of the mindset factors, it is really helping to take what a client is actually maybe already good at and helping to use that in new and creative ways. And that, we've been talking about the theme of less is more, that in ART, we don't need to know the actual, for instance, in trauma, if you're helping someone with trauma, much about the actual event that happened. Maybe you get the client to give a name to whatever it is they're dealing with, but there's no need for us to go into the details of whatever that is. And we're still helping the client through that. So in very useful ways. And the same thing about SST. It's what I would call a stripped down way of really providing a lot of meat, if you will, in this to really move forward for these clients that we're serving. So again, these are some of the challenges. And maybe in this conversation, it'd be nice to maybe talk about any of the doubts that you have kind of going in this, because I get it. There probably should be some doubts. If you're thinking like, man, what can really be done in a single session? Those are the things that are, I think we'll be working through a bit as we do some just follow-up conversations from this training for those who are interested in applying this work. I mean, that's my hope, is that we have maybe monthly conversations. We'll talk more at the end about kind of what's next, but just kind of just some ongoing work about what we're learning from this, and having a group of people who want to continue to grow and learn about how to apply this together. So, and some of these issues, like what if someone's in crisis? What if they have significant mental health issues? Is this even appropriate for this type of work? And I probably should put to rest a bit, even though I'm saying single session, it doesn't necessarily mean that, okay, I'm going to cut you off, that's it, you don't get any more sessions. It doesn't necessarily mean that. What it really is about is that a single session stands alone, and that may be enough for the client, and they do move on. But if clients want more sessions, they should always have the ability to access more sessions if they feel that would be helpful. But for some clients, and from what I've seen about kind of in clinic situations where there were additional sessions available, it was a little uncanny. Almost all of them had like somewhere between 40 to 45% of people decided not to take any additional sessions, that one session was enough. And then the rest. So that's it's something to keep in mind, perhaps, as you try to incorporate this in your practice, is that there will certainly be at least a little over half will probably want additional sessions, but slightly less than half will not. And so that would be useful to be thinking about in your planning if you are going to incorporate this. But it's really a mindset shift, changing how we think about things. I'll go through, there's a therapist who kind of postulated these 14 different mindset shifts that therapists will go through as part of trying to adapt single session models. So let's look at that. We'll talk if you want to at any point unmute and maybe share a little bit of what you think might be challenging for you or maybe challenging within your practice, because I'm guessing if you have some of these same challenges that other people will too. So, but let's look at some of those. So one of the mindsets is that a single session may be enough. That a client, no matter what they're bringing through your door, even if they seem to be just some really deep end issues, that people can still experience some help and relief from that issue, even if they never get to maybe, I think of trauma a lot, right? That many people experience trauma, but many people aren't ready to address their trauma, especially more directly in a trauma-focused type of therapy. But they may benefit from some things that could help them better manage perhaps the fallout or the symptoms they may be experiencing. And that may be important enough. There was I'll just small aside, went to a training, this is a number of years ago, but he was a guy who ran a number of clinics devoted particularly to treating trauma. And what he said has always kind of stuck with me. He said, most of the clients we serve never get to the point of addressing their specific trauma. He said, most of our work is helping to create an environment, whether it's in the family they live in or within the relationship that they're currently in as adults or whatever, of helping to make that, these are my words, trauma informed, meaning how does that need to be set up so that people are better able to live in those situations because they're not being triggered, and so there's this general awareness of how do we develop an environment that can be healing and not triggering without necessarily specifically addressing the trauma itself, whatever that may be. So number two here, therapist plays an active role in this. It's not, and again, ART is a fairly active role, right? You're leading your client through this process, even though the client may be mostly internally experiencing what you're doing. You are directing them through and actively leading them through that process. So there, again, many parallels to this. People have resources they can use to feel better. I think that's an awesome belief to have no matter what in this, to believe that clients have some capacity to self-heal from what they're dealing with, given some of their resources. Number four, the client's an expert in their own life. And again, this is that idea of agency, right? That clients have the ability to make choices that are good for them, that help them. That's very empowering in the role of therapy. Different methods may be used as part of this. And again, I mentioned that in the single session world, there are different models out there that could be incorporated within that. Narrative is one, cognitive behavioral therapy. And again, we're going to be talking about solution focus today. Further sessions may be needed. They may or may not. So it's a corollary to some degree to number one, right? A single session may be enough, or further sessions might be needed. Either one may be true. And that there's a broad range of application of this work and with lots of different folks. And that's the exciting piece to me, that it's not just limited to a very narrow slice of the population, that a lot of the clients, and I'm thinking particularly with if you have a clinic or wherever that has long wait lists, that you could actually do a single session with a client on the wait list to perhaps help them as they're waiting in this process, without necessarily you feeling like you have to then become, you have to make this very clear, right? Informed consent with the client, that you may not be the ongoing therapist, but that you'd be willing to do something that would be helpful to them as they're waiting for perhaps a therapist that could work with them longer. So it's fine to aim for small or simple interventions. And I think we've seen this a lot, right? That I know I've seen with ART and some of the work I've done with clients, it's these shifts in their thinking, some small, some large, but that they've been able to make often through ART that has just reshaped their approach to life or their approach to a particular issue they were dealing with. So small is good. Nothing wrong with that because small can make something bigger happen over time. It's okay to not necessarily know all the details about things and about the client and stick with the here and now. And then most of the change is going to be happening outside of session. Again, what this you'll see as we walk through this process, it creates a really concrete plan that the client takes home, and then it's up to them to implement it. As part of that structure, you do need you don't want to just wing it and go in there and okay, what do you want to work on? Having structure as part of a session is very helpful. For one, for the client, but from a trauma-informed perspective, right? Structure, predictability, all those things are very trauma-informed concepts. So approaching therapy with this will be very helpful for those who need that type of approach done with them. And boy, you can quickly establish, connection and a strong alliance with the client doing this. And you'll see this in some of the language. And I have some things I'll say a little later about that, but there's some really nice use of language that really helps in that process. And so we'll talk about that when that comes up. And nothing's taken for granted, right? That even some of the very small things that a client might say in a session could be used at some point as a point of emphasis or something you may pull into the plan that you're creating with them. So it's helpful to just be very good listener in this process to help draw some of those things together in a useful way for the client as well. So, all right. Now here's where we start to get in some of the stuff from Canada, and I included some of I didn't include all the slides that were part of the Canada stuff, but I did bring some of the things in prior to going through the forms and how they structure a session. But I think these again, assumptions or belief mindsets, if you will, are really useful. And you'll see some mentioned a bit before, but some new ones as well too. That again, good things can come out of a session. We talked a bit on that. Change can and is expected to occur. This is a small aside, I have become fascinated with language and the expectations of the therapist within the session and its impact on the session itself. And there are some interesting research that's out there related to that, meaning how are things affected by the therapist's mindset going into it and how that contributes or could potentially distract from the work that could be done in a session. And so there's some helpful mindsets, like if you go in there expecting change is going to occur, what do you think that might do to the client? How do you think that might energize a client or begin to build for them a belief that something different could happen? I think that's just cool. And especially if you only have a single session with them, why not? Install some beliefs that would be useful and helpful for them. And then we talked about kind of talent, skills, strengths that could be brought to bear on these problems as part of the process. Just these are important to note that really, so solution focus. I will say this: they call it consultation, single session consultation. I'm not sure exactly why they did that. Maybe it's a Canada thing. I don't know. But this is definitely therapy. I mean, you could frame it as consultation to some degree, but you are you are working with someone on an issue, a problem, helping them come up with a potential solution to it and asking them to implement that. I don't, I see that probably more as therapy, and everything else that I've seen, like single session therapy has many or has different names to it. So maybe that's I don't know what that, I don't know. People can't necessarily agree what's therapy, what's not therapy. But I do think that I will say this, these sessions are can be very therapeutic. Um, but the important thing to remember is that it focuses on the present and the future. Doesn't really do anything with the past. And if you're familiar with solution focused work, that'll make a lot of sense in this. I've not been narrative trained, but I would imagine narrative might be interested in knowing, what the story the client's been telling themselves. So that might be a little past orientated, but they're trying to, create a new narrative for the client. And again, and then we're talking about small steps, and small steps are good in this process because small steps create hope, and hope can create change, and all these, dominoes can fall in a very positive way. Before I kind of jump into much further, I don't know if anyone would like to talk about, just as you've maybe perhaps your thoughts even before you attended this training or as you look at some of these mindset shifts, what are some of the maybe challenges to that? What would uh, what would be maybe something you're really going to have to grapple with to possibly in this work?
For me, I guess I just have a question about like past complex trauma, and maybe those are the clients that end up coming for more than one session.
Hmm.
But just what if there are multiple complex traumas in the past?
Right. Uh, my quick answer to that would be it depends on what the client brings forward in that session that they want help with. They may, so that would really dictate where you go with that in the session. And for some folks, it may be, I ain't touching that, but I do want some help with this, or it might be you'd have to kind of help them break down perhaps an area of focus. And again, you'll see how that's kind of structured in the, and it wouldn't, and obviously if you're doing solution focused work, you would be probably talking more about symptom management or just kind of exceptions to the uh, where exceptions occur related to the impact of the trauma on them. Are there, and that would be more of the focus, yeah, than the trauma itself. Okay. Anyone else want to share? I think for me, and again, and particularly before ART, it was this idea that like a single session. And I was aware that that was out there, but when you think about some of the barriers, right? If you're doing insurance-based work, you know, sooner or later you're going to have to do a diagnostic assessment, right? And you're going to have to, and some of these pieces that are often the first thing done right out of the gate with clients, and then that starts to, or if you work for an agency, they may have certain limits on what could even be possible in terms of from a therapy perspective. So I think that was the challenge a bit for me is like, okay, how am I going to incorporate that within this more medical model perspective related to that? The good news is that most insurance companies will pay for a session before needing to produce a diagnostic assessment. So you got some flexibility that uh, could be used in this if possible. And obviously with MA or uh, some of those, you have up to 3 sessions before a diagnostic needs to be done. All right. Again, there's some continued assumptions here in this solution-focused brief therapy. That's the SFBT acronym there. Strengths, I think all of us, would say yes, we want to leverage folks' strengths. In a solution focus, they do a really good job leveraging strengths. It's really an integral part of the model. So that will come forward very nicely in this single session model. This idea of change is always happening, and change is significantly correlated to the client and their strengths and possibilities. Talked about smallest change, small steps. I like this idea of the person is not the problem is the problem. So many clients that we work with internalize the problem as being something about them, right? I am worthless. I am, whatever, awful, all these things. Uh, this really it tries to steer the person to awareness of the problem, externalize it to some degree, and help them realize that this doesn't define them. It may be part of their world, but doesn't necessarily have to define them. Yeah. And then solution focus is very pragmatic. If it's not working, do something different. Everyone know that old Bob Newhart skit, just stop it. A little like that. And then if it is working, how can they do more of that as part of the process? So, right. So this is really here you can see the structure in it, and we're going to go through each of these pieces in more detail. But first you're establishing the shared purpose for why they're there, and you'll see some of the language they use as part of that to make maximum use of the single session that is often part of this work. Then we help the client identify their top problem and their top hope. They pose the miracle question. Most of you are very familiar with the miracle question, but if you woke up the next day and your problem had miraculously resolved itself or changed, what would be different? How would you act? Those types of things. You do some scaling as part of this. Love scaling. Really nice way to bring some nuance to the conversation with the client. And you'll see how they utilize scaling in this context. Looking at the exceptions to the problem, which is again a hallmark of solution-focused work, and then bringing ideas forth from that that go into a plan that they can utilize, and then you wrap up the session, maybe do a satisfaction survey or have them do a satisfaction survey, and you send them on their way. So, all right. So again, you'll see some of the language in here. You'll again get a handout. You'll get the same information. And I'll just point out that some of the pieces that appeal to me. Now, what appeals to me may not appeal to you, but I just think some of the language here can be very useful. And even in that, notice some of the bolded pieces. Just one consultation can help quite a bit. Already that sets the expectation that the time we're going to spend together will be useful to you and can help. And I think that's the power of language. And so I think I would encourage you to kind of keep elements of the language in here just because it helps set the expectation for change to occur, and that really I mean, in some ways you would frame this, it's inevitable, right? We change all the time. The cells in our body change over supposedly, every 3 to 4 months, all the cells in our body. So who we were, just 6 months ago is not physically who we are right now. And so I think there's some useful pieces about that you could help educate your clients about. You're changing all the time. It may not sometimes feel like that, but it's hard to stop change. Now I'm getting older. We're all getting older, right? a day closer to death after today. So that's also part of the change process. So, but just really, and then this kind of next piece here of just really reinforcing the fact that the client took the effort to get there, to have this conversation, because just showing up matters. If there was something took away from the from COVID and some of the challenges that brought about, and I remember helping my daughter through some of this because she was 18 and just just in college when that happened, and she was working and she was talking about so many work or people just aren't showing up for work, and it's like, half the battle of being a good employee is just showing up for work and doing what you're supposed to. So the fact that the clients are getting here to have a conversation is awesome. And the fact that they did that shows they have some motivation, right? Some hope that things could be different. So really layering that in there. And that, again, this whole conversation is moving towards getting an action plan. And love the word action plan, right? It's not just a plan, it's an action plan. And I know I've said this to clients more times than I care to count over the years. Insight is overrated. I tell them. I said it's not until you take action that something different happens. And so that's a great place to kind of move people towards, by the end of the session here, so there's something they can actually take action on and make a difference in their life. Okay, what's the person's top problem? Again, the goal in this is that you don't want it to be too ethereal, too big, because people will have a hard time wrapping their head around it if it's too big, and you will have some difficulty getting to define something. Like if you're just saying, I want to feel happier, if that's like client comes in, that's the top problem, I want to feel happier. Way too big, right? Because that's not tangible enough. So then you would kind of ask the question at that point, okay, so if you were happier, what would you be doing? How would people around you know that you would be happier? And so you begin to kind of whittle that down into something much more tangible for them. And you'll notice in some of these, it'll actually be in the paperwork too, there'll be these different prompts you'll see that will help you make sure you do that. It's not just you fill in top problem, feel happier. You'll see some of these. Let's see. I'll just read it from this. So that this is the top problem. This piece, actually, hold on. They changed the wording on this. They call it the top reason for seeking services instead of the top problem. But what they say, there's a bunch of prompts. And for instance, they'll say, what brings you in today? What part of your difficulties would be most important for us to talk about today? Great prompt, right? Because that's getting them to be more specific. And if they struggle with that, there's another prompt here. What would someone close to you, or how would someone close to you describe this problem? And then you would say something like, be specific as possible. And then another prompt, in what ways have you tried to address or cope with this problem in the past? Of the things, what has been helpful and what hasn't? Again, all on the sheet here. You'd make little notes in here. It really helps create and you'll use this information to put on the client plan, which is really kind of stripped down version. It won't have these prompt questions, but it'll just have the basics. Like it'll have, top reason for seeking services or top problem, and you just put in whatever how that's defined. All right, and then the top hope. Hope is a curious thing, and I'm actually doing a little research on science of hope for another presentation, and I'll share just a couple things or one thing really from it. Hope is really a bringing together of three different things. One is a goal, an important goal for the client. Two is a excuse me, a pathway to get there. And three is that the client feels they have some agency or ability to make that happen, meaning that they can move along the pathway to achieve a goal. And if you're missing or struggling with any of those three, more than likely you're going to reach an impasse or have difficulty increasing a person's hope. So for instance, if there's only one pathway and they encounter a challenge, either they're going to need to figure out kind of a path, a slightly different path to get around the obstacle, or maybe a whole new path. But as long as they have a path, they're likely going to be okay. It's when they don't see a path and they stop seeing other possibilities that problems occur, because then they start to feel hopeless, right? So that's a little trivia about hope. So we're tapping into the idea of what is their top hope in this during this session, and so goes to this fact of what's needing to happen today in our meeting for to feel like it was worthwhile. And again, you see some of those pieces here. What are your hopes? What would you like to see come out of? And again, helping them stay focused on this. And then they define some of this, the top hope as really being the positive opposite to the top problem. And you can see some examples here listed on this. If you're lonely, top hope might be spending more time with people that help me feel good. And then you can record that on the action plan. And then you get to the miracle question, right? And solution-focused stuff often talks about video-based language. I used to often talk with clients about following them around. If on this miracle day, what would I be recording? What would I see if I was looking at the videotape, or in the movie about your miracle day? And to help in that descriptive language, right, of behavior, because we're really looking at behavior, right? What behaviors would they be engaging in? And again, if you think of behaviors, you're thinking of action-orientated language, which is what this is all about. So you would jot some of those things down, what would be different, and make that again part of the sheet that the client's gonna take home with them. And you even see some of that typical day language, right? Just like in ART, is typical day, right? Oftentimes we're doing work with those issues where a problem is occurring multiple times usually over a course of a day, and we're doing ART related to that. This one, but the opposite, right? Of what kind of positive things would occur over the course of the day that would let them know that it's been some sort of amazing change in their life. Here's where the scaling would come in. Again, on the sheet for the client, they have, again, very simple, same little scale here. And then you're looking to have them place an X on this about where would they see themselves right now compared to their miracle day. And it's going to give you information. And it's just information, right? Either how close or how far off they feel from that miracle day. And then and this is where small becomes important, right? So let's say they do a 3 on here. They put a X by 3. And you can kind of see some of the promptings that you could have in this. Is this, they ask the question, is it good enough? Because the client may feel, well, it's better than it was a week ago. And maybe they feel like that's good enough for now. And if it is, again, you can kind of see they talk about, well, what do you think is contributing or helping it be a 3 at this point? If they're unsatisfied with that, you could say then, what would need to occur for it to move from a 3 to a 4? And have them behaviorally define what that would look like. That's what that X plus 1 refers to, right? The X would be whatever number they put at first. The +1 would be the next number above that. And you're getting to get them to make small definitions of what would be different. Might have to help clients think small in this process too. Some clients may jump to maybe too big of a leap from what might be happening at 3 to 4, but that'll be your judgment as a therapist, but really helping them define that clearly. So again, you're not giving many suggestions yet at this point. You're just helping them define some of these parameters as part of it. Now you jump into kind of looking at exceptions to the problem. So, where have the times been where let's say they're dealing with some depression, that you even felt just a little more normal, or a day that went a little better than you expected? What was happening that day? What did you do? All these different pieces, and really teasing out these behaviors that they were engaging in that help. Maybe they say something like, I got together with a friend and we went out for lunch, or I went outside and went on a 2-mile walk, or whatever. They're going to tell you certain behaviors they engaged in, and that's really important stuff to be scribbling down in this process, because you may want to incorporate some of those pieces in the action plan. Remember, take nothing for granted. So if they're giving you some of that information, it'd be good to be jotting some of those pieces down. All right. And then again, they talk a little bit if a client is having challenges in remembering or saying don't know. You can always ask them to maybe frame it a bit like, what would their friends notice about them if they can't identify what they would notice themselves? Or for younger people, you could even no, I wouldn't go there. I rethink that. Yeah, talking about who's in their social support system is probably best about how they would define some of those pieces with that. And then you could bring back some of those other pieces. Well, you said earlier that you often felt better when you were doing some sort of exercise or walking. On days you do that, would you say things were different? So that's where you start to pull in some of the other stuff. And again, it's and some of it might be just the fact that they got here. How were you even able to get yourself here for this session? There could be something part of that you could take away in this as well. So, and then you really help them define what are those 3 steps, just to move you one number up from where you're at currently. And either that's going to become clear in what they've given you already, like for instance, mentioned the exercise piece, and there's some really solid research that writing down goals, writing down a plan makes it significantly more likely that it'll happen, and that's partly why I believe they utilize a serious action plan in this process. So notice that they identify the action and then when to do it and where you can do it. And you could do some problem solving a bit in this. I remember some time ago, there was a client I worked with who, again, wanted to exercise more. And he had said that when he changes, and when he brings the gym clothes with him to work, because he usually exercises on the way home, that made a difference. What we did is we actually kind of built off of that and just said, I want you to change in your exercise clothes before you leave the office. So as you can imagine, if you're gonna have your exercise clothes on, you're most of the way to exercising, right? He just has to stop. And as long as it's like, so it lowers the resistance to engaging in the behavior, because you've eliminated a potential barrier, like I don't have, I'm not dressed or whatever, don't have my clothes, whatever. Um, but doing that, so that's where that when and where pieces can help uh, further identify how to make that more likely to happen, that particular behavior you're asking them to do. And again, they're saying, you have lots of permission to suggest steps, but again, incorporate those pieces that the client has mentioned or that you've identified in the conversation with them about strengths and how they can incorporate those in these situations. And notice that they have a social component to this. Two people who could help me take these steps. I think that's pretty cool. The social, we're so much more successful in goal achievement when we have other people part of the process. So for someone who may exercise or may go for a walk, that they have a friend, that they can arrange to go walk with 2 times a week or set up, time at the beginning of the week with them. Those are all good ideas, good suggestions, and it makes it much more likely that it's going to happen. And you're also going to get insights into who their social support system is. Here's a little slight sidebar, but it's worth the price of admission today. If you're dealing with someone who's struggling to share or has struggling to come up with someone like a support person for them, ask them this question. Well, who have you talked to or texted over the last 2 weeks? Uh, those are the people who are in their social circle that they are interacting with. And that in and of itself can be really useful to identify folks they're interacting with. Now, not everyone is maybe positive, but it's going to give you a lot more options than I don't know. Because usually when those situations I don't know, if you can read between the lines, is I don't want to impose on other people to meet my needs. is one of the takeaways possibly. So social stuff is important. And then you take a kind of this is a nice addition too. You're going to look at what are the obstacles to making these 3 things happen that we just identified. And notice that they use the language, what's your main inner obstacle? Usually it might be a thought or a certain way of thinking in this. This is, as I've thought about this, and I haven't incorporated some of the ART things with this. I've done this separately, this process separately with clients, but I could just see that. So this would be, I think, a great time to maybe pull out eye movements and do a set of eye movements with someone. You'd have to obviously inform them that you might utilize these earlier in the session, but bringing forward, having them, for instance, think about what, I'm going to do a set of eye movements here just to help maybe process some things. And I'm going to ask your brain to think about or bring forward as we're doing the eye movements, what could be the biggest obstacle, inner obstacle for you in this process? Set eye movements and see what comes of that. I think this would be a tailor-made for something like that. And then whenever that inner whatever obstacle is identified, then one action or thought to overcome that inner obstacle. And then you can kind of see down at the bottom, and then if this occurs, then I will. There's some really useful information out there just about habit formation. And often if you link new habits with old, or not old, I should say established behaviors. For instance, if you, let's say every time I brush my teeth, I'll think of something I'm thankful for that day. That would be taking an established behavior and pairing it with a new behavior. And the idea is that it strengthens the association and usually the follow through with that. So something to keep in mind when you're helping people establish new behaviors. Take a habit that they already do pretty well and attach a new behavior to it that they have to do with that same format. When I do this, I will do this. But this is it. If I think about this, then I will help them answer that question. This is kind of a nice touch. There's no specific. It's just something you write at the bottom in this one area, but just noticing something that you want to reinforce or recognize that the client has done in this process that you feel will help them carry through or be useful as they carry out this action plan. And it's done in the second person, right? So I noticed that you took the time to get to here today's session. You seem motivated to make this change, whatever X change is in your life, and you have thought of some very actionable, concrete things to help you with that. I think you'll do well, or something like that. So that would be just what you would write. It's almost like a little message to the client at this, and then that you wrap up the session. Maybe ask for feedback from the client. Was this useful? Did this did this meet your expectation that whatever they mentioned at the beginning of the session, we're able to accomplish that? Sometimes that's even helpful. I've seen in many single session models where that's asked in the middle of the session. Halfway through, they just kind of stop and say, hey, just want to check in with you. Are we focusing on what's important to you? Are we addressing the concern that brought you here today? Do you feel like we're taking some steps to try to change that or make that better? And if not, if whatever feedback they give you, try to incorporate that feedback as you try to finish out the session. But that's a really useful thing to do in this process as well. So, and then you just take what there's a kind of a therapist form, and then the single, you won't be able, could I pull this up? Maybe. I'll pull it up at the end. But it's just a very simple form that takes everything that you've identified that on your sheet, it'll go on here. You could even have the client, I mean, technically you could have the client have this copy on a clipboard in front of them if you're seeing them in an office, and they could write down the stuff on here as well. There's no law that says you got to do it. You just have to walk them through, putting the things on there. And actually, that might be interesting. In fact, if I had my druthers, that would probably be better because I think that's going to drive some of these themes home for a client if they're putting it on the sheet than if you are. So something to think about as part of this. All right, and then you can kind of see here's the short little survey that they incorporate as part of the end of the at the end of the session. And if you had a front desk, you could have them make sure they fill it out before they leave. You could also have a client fill it out, in the office if you're just a solo practitioner or however you'd like to work it. But again, feedback is feedback, and I think it's often useful for any ongoing evaluation of this process with folks. So, I'll just actually I'm going to stop here. Kind of open it up slightly as we've kind of talked through this and you look at this and you think about this single session model, what starts to come to your mind now? Are you like, that seems pretty doable, or I seem pretty excited, or this is like this is missing stuff for me? Open to any and all suggestions. Just curious kind of what's going through your mind, because I know your minds are trying to process this.
Yeah, I was just going to say, I mean, this seems like a format that I would probably actually be really comfortable with. I've done a lot of crisis intervention work, and so it reminds me of like the CISM training, psychological first aid,
Good.
All of it, solution focused, all of it with ART.
Yeah, excellent. Yeah, I don't think is if you've been exposed, for instance, solution-focused stuff, all this will feel actually probably pretty familiar.
Mhm.
Maybe if you haven't, there would be a little, because solution focus again is a little different way of doing therapy or a different way of looking at the world.
Mhm.
Um, so
Yeah.
I went to UW Milwaukee, which was like the hub of solution focused stuff. So when I was in grad school, I got many of my profs were affiliated with the center down there with Insoo Kimberg and all those folks. So it was actually pretty cool to be exposed to all that. But
Mhm. So yeah, I was actually trying to figure out in what ways this was actually different than solution focused.
oh,
It seems so
it's
similar.
it is. It is. It's brief. They've labeled it solution focused
Mhm.
brief therapy,
Brief therapy. Yeah,
and
that's
solution
true.
focus tends to be fairly brief in general. But
Mhm.
incorporating elements and ideas within a single session is really yeah.
Mhm. And it'd be good for EAP clients
Oh, for
too.
sure, for
Mhm.
sure. Yep, yep.
Okay, that's all I have.
That's okay. Thanks, Guy. Liz or Joy, just anything you wanted to?
I like it. I'm kind of struggling with just thinking about the time of one session because I barely fit. If I start right into the ART and just do the ART, that's all I can fit. So I'm just
Right.
thinking through all the tasks too and like the miracle question, just all those steps. Like
Yeah, that's a
how do
great.
I fit it all in
Good,
one?
good, good, good question. And maybe you don't.
Sure.
Or maybe you do this as a standalone, and then there's something that comes out of that that maybe you follow up with an ART session. Uh, Again, it's really they talk a lot about that the client decides, right? So if you do the session, let's say you do it more as just or single session like therapy session and not incorporate ART, the client could have some choice depending on whatever they worked on, that for you to layer ART on at another time. I think you'd have to have the flexibility. And again, this would be challenging if you're scheduled in such a way, like just on the hour. Because my experience with ART is usually it was more in that hour to hour and a half range session. And so you'd have to, I mean, and there is ways of billing that, you know, makes that, you know, or could be more advantageous, but you'd have to have some flexibility with that. Or if for instance, if you're doing private pay, then, maybe you got a lot more flexibility than you would if you have someone with insurance. So that's just been my experience with implementing ART. But this gets a little to, and we'll talk about kind of what's next, because I do talk a little bit about maybe just trying to incorporate some of these concepts in your sessions without having to like feel like you have to like jump in and do a single session. Because again, I think some of the language, some of the way it's framed could be useful just with any client in any situation. So, okay. Thanks, Joy. Liz, anything you wanted to add?
Sounds great. Keep on going.
Okay. Okay. Well, let's just focus on the final slide here. Uh, doo-ba-doo-ba-doo. uh, and so, uh, and this is idea of just kind of looking to incorporate uh, ideas in this. Even, again, like I mentioned, even though you can't fully implement. So, for instance, scaling, the miracle question, the language used in there, like the expectation. What if you just walked into a session with a client, maybe that you've been even seeing for a while, and you said, "Hey, I just want to like let's look at let's making this session something come out of this that's really useful to you by the end of the session." If that was the case, what would that be? And how would you know if that was different? Maybe you can, again, use the language without necessarily having to use the actual structure of the single session brief therapy model. Uh, so I mentioned the eye movements around their kind of inner obstacles. That was something that jumped out at me in looking at this. There could be other pieces, and I don't know if anything jumps to mind for anyone when they think of ART that you would either pull into ART or you would pull into like this single session piece from ART. Both of them have, if you notice, even in the language within ART, it uses some of the same with the idea expectation for change that is used well in many therapies, but I think those complement each other as well. You could think though about where situations might come up where you have a bit more of the ability to use this in a more single session format. For instance, if you have a client who came in, maybe they're fairly, they state right away they're ambivalent about whether therapy is going to work for them. And what if you just said, okay, let's just take this. All we have is right now. Let's use this session, do something useful that or feel that you would be useful and helpful to you, and let's just see how it goes. Believe me, there's plenty of clients over time that show up like that right in your office on a first meeting, and so it could be a nice way to just ease someone in rather than feeling like they have to talk about their whole history, especially if you often do diagnostic assessments at your first session. This might be just a real practical way to help them receive some benefit, maybe help with engagement, and then they decide whether they continue with you after that first session or maybe that's enough. And again, hopefully, that would fit with, because again, I think most insurance are going to pay a single session without having to come up with a diagnosis. So, or at least not an official diagnosis, I should say. Are there, and then you can kind of see there's some other areas where this could be used or maybe more. I've been trying to have the clinic I have some affiliation with to be thinking about doing this. They haven't pulled the trigger yet, but they're getting closer. But I think this would be a really interesting, this would be tailor-made for a walk-in service. But, are there, with different clinics, it might be just, talking with administrators and just say, hey, there's this, I'd like to try this or maybe layer this in. Could I see, maybe I could try this with a waitlist client. We mentioned that as another possible, if your clinic has a wait list, just and you have an open slot, that you could see them. The clinic would probably appreciate that you're trying to fill open slots as part of the process. So maybe they'd be open to that. Do you see, and maybe as a kind of final piece, do you see any ways that this process overlaps at all with ART? Or is there anything you could see that just might give you some like, oh, I could see doing this or that or these elements in certain areas?
The part where we're posing the problem as being kind of outside of the person, it's like external, that reminds me a lot of metaphorical, is it metaphorical moment or something like that?
Sure.
Which I don't use very often. Yeah, so it seems very similar in that regard.
And also the inner obstacle reminds me of the Little Liar.
Oh, sure. Yeah. Very good. Yes.
Yeah. The scaling. Yep. It'd be nice to have a scale like towards, well, I mean, I know there's the questions, but it'd be nice to have like a scale towards the end or at the end, kind of like you do with ART.
Oh, there you go. Process improvement. That's good. Yeah. Maybe. No, that makes some sense. I don't think there's no, you're not, I mean, you can add elements that you think would be useful to this again, but this just gives you the structure to be able to kind of, it's a, what do they call that? Um, what do they call it? It's something that's tailor-made or ready-made, like,
Customized?
no,
No. Oh, sorry.
like, well, it's kind of like, shoot, whatever. But just be able to unbox it and go, right? You can just take this and go. There's
Oh,
not a lot of you know, not a whole lot of setup you would have to do just
mhm,
to incorporate this. Because again, it's it's simple, it's straightforward, it's structured, all these things that I think would be very, with someone with some therapy experience could pretty easily step into this and just
mhm.
move it forward. So,
Yeah, I think it would actually be, for me anyway, I think it would be easier to complete the steps in that within an hour time frame than ART session.
hmm hmm yep, yeah, and yeah, and even though I'd like to, eventually explore the ART with single session, perhaps, I am open to also just hearing how single session uh, how if you're able to do that, incorporate single session in your work and what you're experiencing as part of that. Again, I think there are lots of places and opportunities where you're only going to get a single shot. And I really want to um, help do more of that because I think imagine how many more people could be helped if we're able to do that effectively. So that's my interest in stuff in this.
I mean,
So,
even just to incorporate more sets of eye movements throughout those steps would
mhm,
be one way because that would help keep somebody, if somebody's coming in for a single session, oftentimes they're like in crisis or near
mhm.
crisis, and that can help calm them down and, get them more into their thinking brain a little bit
Right,
better
right.
too.
Yep, yep, yeah. Uh, okay, good, good. I will actually, if uh, I will send it out. Well, actually, could you guys do me a favor? Could you just use the chat and put your emails in there, and I'll send you the stuff, and I'll send some bonus material or just some stuff that there was for instance, I ran across a pre-intake questionnaire that was really, I thought, really interesting. If a client filled it out before they even saw you, that would be related to single session model, which helps actually begin them thinking about some of these questions as well as some additional pieces that I thought, man, that'd be cool to use. I haven't done anything with it, but um, yeah. So make sure you put that in the chat, and then I will send stuff out to you guys directly, and I will send stuff to the other folks who couldn't be there as well. So, final thoughts?
No, I think that model can be used. I mean, even if it's not purely a single session,
Hmm
I mean, I think you can use that model to help a person actually realize they have more strengths than they
Right.
realize they do and get them thinking about their own solutions to their own problems.
Yeah,
So
for
that if they
sure.
are really going to be there only one session, at least they know, hey, I'm more resilient than I thought I was.
I'll tell you what, I think you could use this with someone you've been seeing for a long time. You could just, and usually by that, usually these clients we have a good relationship with, right? And we've been seeing for a while. You could just say, hey, today I want to try something different. Say, I just went through this training and they gave me a kind of a unique way of doing a session with a client and wondering if I could walk through it with you. I think you'll find this very useful and may even make, whatever, make significant change as a result of it. But can you humor me and let's walk through it? I think you'll find this very useful, blah, 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 blah. You know, why not? You'd be doing something, you'd be practicing. And again, like anything, right, the more you do it, the more comfortable you get. But I think I can imagine most clients, particularly if you've been seeing them a little while and you have a good engagement with them, would be like, yeah, hey, let's do it. So yeah, keep that in mind a bit. And then what I'm hoping to do again is I want to set up, I'm thinking monthly, maybe every other month, just conversations with folks who are trying to implement this work, and to share kind of, here's what I'm finding works really well, here's what doesn't, and just kind of we learn together a little bit about this, because I just think that this is a cool way of doing things. And again, the eventual incorporation of ART with single session thinking and seeing where that leads us.